Good evening. Welcome to City News. I'm Adrian Ghobrial. Thousands of students returned to in-person learning across Ontario today for the first time in 6 months, and thousands more here in Toronto and in other regions will be joining them this Thursday. Now, there's one question on the minds of families. Is school safe for our children to return to? We asked that very question today of Ontario's Medical Officer of Health, a member of the science table, an epidemiologist, and an ER doctor, so you can make your own informed opinion. School's back from summer, but with Ontario battling the deadly Delta variant, is it safe?
Look, what means safe?
We broke down the question in two parts, separating high schools and elementary, where children 11 and younger are still ineligible to receive the vaccine. The scientific director of Ontario's Science Table warns our youngest students have a bumpy road ahead.
Will it be completely safe? No, it's impossible to guarantee that because we have a highly transmissible variant, but we're much better regarding ventilation and filtration. We continue to do the right thing with masks. We need to basically bridge the gap until we can start to vaccinate those smaller kids.
Prominent epidemiologist Colin Furness and ER Dr. Kashif Prasada were less measured with their professional opinions when it comes to elementary school settings.
It's going to rise quickly and things are going to quickly get out of control the way things are going. And I would have a low threshold to pull your kids out when that happens.
What we are essentially doing is holding our breath and saying, we know COVID spreads readily among kids now. We know it spreads readily among people who are unvaccinated. We know it spreads readily among groups of people clustered together. And we are creating all of those conditions when we open schools. So no, it is not safe. It is certainly not safe.
Each medical expert we spoke with outlined the importance of keeping schools open, though Professor Furness and Dr. Prasada believe without a robust rapid testing program similar to the UK, COVID will spread through our schools. Take-home PCR tests will be available across the province for teachers, students, and families, though the results will take 1 to 2 days. Ontario's medical officer telling City News that rapid tests will only be used if cases rise rapidly.
Our rate of illness is so much smaller than the UK. So we're roughly at 33 cases per 100,000. England is at least 10 times higher risk. We look at the evidence for all of these interventions on a regular basis, and we'll put them into play if we think there's value.
76% of individuals aged 12 to 17 have been partially vaccinated. 64% of that age group have been fully vaccinated, giving a level of protection to high schools.
If your child is vaccinated, then they will likely be safe, especially that we know that vaccinated won't get severe disease. If your child is unvaccinated, your child has a 1 to 2 chance out of 100 of ending up in hospital.
I'm not happy about the safety profile of mixing vaccinated, partially vaccinated, and unvaccinated students. If you want to develop variants of COVID that are vaccine resistant, then the way you do that is mix unvaccinated and partially vaccinated people together in close quarters. That's the way you do that.
So how should you measure the safety risk for your child?
How prevalent is it in my community? If there's COVID is running rampant, then I wouldn't send them. How is ventilation fixed at my child's school? Are there at least 6 air changes an hour in the classroom? But I think this is the time when parents need to get together with each other and sort of form a ring of protection around all of the kids.
Now, all Ontario teachers who are unvaccinated will need to do 2 rapid tests per week, though here in Toronto, TDSB School Board trustees recently voted unanimously to mandate vaccines for all teachers, though that policy has yet to be put in place.